Several reasons why you might not have vaginal lubrication. The simplest reason is you may not be sexually aroused. One of the main signs of sexual arousal in women, physiological sexual arousal, that body arousal in women, is vaginal lubrication. And if you're in a sexual experience and you're just not that aroused, maybe the right buttons aren't being pushed, maybe enough time hasn't been spent for you to build your arousal. So on average, it takes women about 20 minutes to be able to really fully build their arousal. If there hasn't been enough time, if the right buttons haven't been pushed, if you don't find it a very stimulating experience, then yeah, you're probably not going to have vaginal lubrication. So that's one reason you may not have vaginal lubrication. And what that means is more time needs to be spent on you building your arousal, on finding what's pleasurable for you. Another reason why you may not have vaginal lubrication is a medical condition. So there are illnesses and medical conditions that can cause a lack of vaginal lubrication. The most common is going to be menopause, whether that's menopause that was naturally induced. So average age of menopause is about 51, 52, or if it is induced from a surgery, like if you had your ovaries removed, that's going to induce menopause. So whether it's surgically induced or naturally induced, menopause is going to probably cause vaginal dryness. For about half of women who enter menopause, again, whether it's surgical or naturally induced, about half of women have pain with penetrative sexual activity because they have so much vaginal dryness. So that's a second reason why you might be experiencing vaginal dryness. A third reason is medications. So there are a number of medications, most commonly antidepressants, which are going to reduce your desire. And if your sexual desire is less, that means your sexual arousal is probably going to be less as well. And if you're less aroused, that's going to lead to less vaginal lubrication. And lastly, there are medical concerns and illnesses such as Sjogren's syndrome or graft versus host disease that can cause a lack of vaginal lubrication as a side effect. So if you're experiencing any of these medical issues, lack of vaginal lubrication because of a medication, because of entering menopause, because of an illness, talk to your primary care physician or your primary medical provider because there are options. The easiest options are going to be an over-the-counter lubricant. There are water-based lubricants and there are silicone-based lubricants. There's also a vaginal moisturizer, and I'll talk about all these in my next video.